I started at Moffie about it's my 15th year at Moffie, and it was definitely time to bring a neuropsychologist to cancer care, not just psychology and talking about feelings and coping, but it's really about the time that people started getting pretty unhappy with some of the long-term side effects. So the goals are basically to talk about the concept of the cognitive changes that we see with cancer and cancer treatment. Obviously, this is unique to transplant, but a lot of the literature involves other cancer populations, either out of convenience or just what other researchers had thought would be most beneficial, and also which groups say yes. So you'll see a lot of the research when you look out there is really with breast cancer patients and long-term lymphoma patients. I want to talk about the differences between what happens acutely at the time of transplant in the first couple months, because that really is rather different than what happens 6 months to 6 years or so after transplant. I'm going to go very briefly through the literature and about some of the more exciting things that have happened lately, and then really talk about the coping and certain things that people can do with this problem. So when we say Chemobrain, some people can laugh it off and sort of say, oh, it's, senior moment, or look at me, and look, I just made a mistake. But really what we are talking about as clinicians are changes to the higher level of thinking, things that you really need to be able to do to get through your day. Learning, memory, focusing, being able to focus on me right now and not thinking about your flight home tonight, being able to focus in on what you just need to do. How quickly can you think? Our world goes very quickly. If you miss something, you may not be able to catch back up. And what we call executive function, or being able to put it all together, to execute your plan of action, to even make the plan. And when we look at the literature as a whole, which is really, like I said, not just transplant survivors, but other cancer patients, there's consistently about 1/3 of people that say these changes are not only subtle, but they're really problematic. And then basically, there's some good news. That's why I want to talk a little bit about there is some clear literature that says there is some benefit for just time, just getting farther out of all the toxins and trauma of the transplant. But then when we look at long-term, there could still be just a little bit different. And I don't know about any of you, but I don't even want to lose a little bit. I like what I have. So, hey, that's 90%. I don't want 90. 90 is not good enough. That's an A- in the real world. And you can see it in the literature called chemo fog, particularly in Europe. So I want to talk about executive function, because when we're looking at some of the more recent research, which is looking at functional MRIs and PET scans, which is what real doctors like to see, right? They like hardcore science as opposed to what someone like a PhD would say. We're looking at what can the frontal lobes do. And the frontal lobes are really what's separating you from every other creature on this planet. Okay? Your frontal lobes let you plan, sequence, do the things in order. You're not going to put your shoes on and then your socks on. Socks first. And you knew that. You knew that from the time you were 18 months old or so. But that's a sequence. Concentrating. Again, I always joke, how many people in this room, have a right hand? How many people are thinking about their right hands right now? You're not. You're concentrating on me, but you have these other things. How'd you tune all that out? Being able to shift attention. Right now, if my phone buzzes, my kids need to know where the waffle maker is because they still can't find it. I will ignore it, but it will pull my attention to this little buzz right here in my bag. But I'll have to come right back to y'all. I can do that, but some people can't. So that's what shifting attention means. And our world is pulling us off task all the time. Reasoning, thinking things through. Inhibition. You may really want to say something to me right now, but you all know that you were asked to sit quietly for 30 minutes and listen. Like, she's wrong, or that just sounds like me. But you all know how to inhibit. If your frontal lobes aren't working, you may be doing things that would not really be socially acceptable. And initiation perseveration is starting something and going till it's done. And this is a big problem. It's this reduced stamina that I see in a lot of my long-term survivors. Boy, will they start things. Just don't get done. So what's the history? Breast cancer patients. First of all, mostly women, like 99%, and they always say yes to research. Not sure why, but they just want to give. I'll sign up for that. I'll do more. So when you look at the cognitive changes associated with cancer care, you're going to see almost all the first studies were breast cancer patients. To confound it, again, showing you how old I am, 15 years ago, stem cell transplant was an option for stage 4 breast. Didn't go very well. But so they also show up in the transplant literature. However, when they complain to their oncologists or even their primary cares or their GYNs, I have these problems with focus and memory, well, you could be anemic. Okay, good call. Let's check the blood. If your counts are low, you really probably can't do a whole lot. Well, you're probably very tired. You're very fatigued. Okay, sure. I'll go along with that. If I'm tired, my body's tired, my brain's tired. But that's not what I'm talking about. Well, you must be depressed, because, you've had breast cancer, well, you've had cancer, life has changed. Go have an antidepressant. I don't think I'm depressed. And then, well, we forced you into menopause. We took away those 10 years nature gave you and did it in, 3 weeks. Possibly, brains for women and men are estrogen receptors, and you need to have some. And if you don't, you could have some subtle changes. But these were the first thoughts, it was something else other than something that had happened to your brain. And of course, when people first realize and they're right out of cancer care or still in the midst of it, there could be a lot of medications on board. So it's thought, well, let's get through your care and get rid of some of all those, medications in your system and maybe you'll do better. But once these people started living longer and doing well and trying to reintegrate to their old lives, chronic problems showed up. So the proposed pathways, once this name got stuck on this Chemobrain, well, number one, cancer can cause emotional distress. Sure, absolutely. Not going to argue that. You can be depressed, anxious, and your life is totally disrupted. And I really think about it in some ways. If you're given 100% of your energy every day, and this is what you were normally doing, and now someone says, well, you've got cancer and need cancer care. Okay, well, at least half your brain's over here doing cancer care, but you still got to do this. Got to get dressed, got to run the house, got to run the kids, try to get to work, pay the bill. So you don't have 200% of brain energy. You still have that 100 that's now fragmented. So possibly. The second pathway that got discussed really was that maybe something we're doing with the cancer treatment is causing changes at the cellular level. Has anyone been on a medication, a chemotherapy agent that left numbness or tingling in their hands or feet? Peripheral neuropathy. That's because it's neurotoxic. Those are your nerves being very angry and unhappy that their ends got fried off and they're firing constantly. They're not happy. Those are nerves. Your brain is made of nerves. There's a very good article that came out in 2008 saying Chemobrain is real, but maybe it's the wrong name. Maybe it should be called Cancer Brain. Well, doesn't quite have that same ring to it. But there were 2 really critical studies that came out that threw a monkey wrench into the Chemobrain idea because these were breast cancer patients who never saw a drop of chemo. They went in for lumpectomies, mastectomies. They let them recover from surgery. They did the cognitive testing, and that same 1/3 of them didn't look good on testing. Can't blame the chemo. They didn't have any. They weren't depressed. Their counts were back. They weren't on any meds. Aha, Chemobrain's a big farce. All those people, they're just whining and complaining. Wrong. This guy Ferguson came up with the idea, well, not him uniquely, but let's think about maybe there's something unique to the cancer that's really overrunning the physiology of the body. Cytokines, other metabolic changes that really rob you of your brain energy. So that's why the idea of Cancer Brain was promoted. Still don't think it has that good a ring. But it's a good idea. And of course, leave your options open and add them together and you get pathway number 3. So let's conceptualize it. I always steal stuff from Christina Myers because she's great. And I've known her forever. And she really is the queen of this area. She really talks about sort of this plant model. You are the soil. You're the medium for which things are happening too. It's your genetic makeup, how smart you are, how hardy is your immune system, and so many other factors. I'm not going to waste a whole slide on them. Everything related to the cancer itself is the seed. It's grown in your soil. It's grown in you. And then we give you pesticides of every shape and form that we can think of to kill, kill, kill. So that's chemotherapy and radiation and all these adjunct medications we throw into the system. And it's sort of an interesting way to think about it, particularly if you need to explain it to someone or you just kind of want to hold this idea. But then again, you can almost make anything grow, and you can really enrich your soil. There's lots of factors we can now work on. But I want to talk about what's really changed the mindset of a lot of physicians now. Silverman decided, okay, testing isn't enough. All this subjective, repeat this list after me and draw me a clock and all the things that we do. Let's look at the brain. I'm going to do a positron emission scan of the brain to see what is the brain actually doing. With these cancer survivors who are anywhere up to 5 years out, while they're taking the tests, so real time, not just a snapshot, okay? And it basically showed that there's a certain area of the frontal lobes, again, that's what's separating you from everybody, every other creature on the planet, had a lower metabolic rate, meaning it wasn't as active, it wasn't using up all the glucose and all the other nutrients that the brain was bathing it in. So when we asked these women, they asked these women to do this memory testing, their brains had to work harder to get the job done. They did get the job done, but they had to do it with much more effort. So there is something at the physiological metabolic brain level. Well, that actually sounds like hard science, right? So all those MDs can really latch on to that. Inagaki, a year later, decided to use an MRI to sort of look at the same sort of idea. Not acutely ill patients. Now we're talking 1 to 3 years out. And there was a thought that the chemotherapy, and these were breast cancer patients that did have chemo, not the ones that just had the lumpectomy or mastectomy. And also, changes were seen. And again, this really helps with the credibility when you go in and you tell your doctor, I'm not right. It's not working. Or my loved one's having these problems and we're not happy with it. Just 2 more and I don't want to hit you with too much science, but everyone wants a control group, right? Everyone wants to say, well, maybe it was something about those 16 women or that one little group. Maybe it was a sampling error. But Silverman smartly looked at women had the chemo with breast cancer and those who did not, because, there's different treatments for different types of breast cancer. And they could definitely see the ones that did not have chemo had much more normal scans. So in this case, it really helps to really clarify the picture. But the main thing here, it's not that their brains are damaged. It's that their brains do not work as efficiently. And this is what I tell my patients. The quality of what you do will always be good. The quantity and the effort that you have to put in to get to that good result will be harder. You can still balance your checkbook, but you're going to have to check and recheck and have someone else check you. But your math is still there. You can still use a calculator. So who's more at risk for the chemo-brain? Age. The older you are, there's basically this idea that you've been exposed to more things over time, and your brain really kind of peaked in its 30s. Doesn't mean it's not still good, because I'm well out of that range, and I still think mine's fine, I hope. But the older you are, the potential for being more vulnerable is there. Premorbid intelligence. This is a huge issue for me. If you're really not very smart, you probably don't care if you have chemo-brain, because you might not even be aware of it. So we don't see those people. And sometimes, unfortunately, in our medical care system, we see this incredible skewing to the higher functioning people because they're the ones with the better jobs and the better insurance and the better access to care. So consistently, when you look in the literature, and you'll see that the estimated IQs are higher than average. There's another confound. Bright people don't ever want to be average. They don't ever want to be high average. They want to remain superior, very bright. They're acutely aware of even just a little dip. So again, when you do testing and someone comes out, hey, you look great, you're average to high average. Well, I'm supposed to be superior. Well, how would I know that? I never saw that. Well, my third grade teacher, well, you're 68 now, and I don't have access to your third grade teacher. Not everybody gets tested. They don't come in with their, SAT scores or their ACT scores or a letter from their mother or whatever would work for me. So when you want to go for some sort of disability, or you want to go for some sort of accommodation in the workplace, or you even just want validation that things aren't the way they were, and you go to someone who doesn't do this for a living, just some doc in a box who's going to take you for a couple $1,000s of testing, you look great. You're average. Okay, doesn't work. So, but premorbid intelligence, the more you have, the more you can afford to lose and still function, but it doesn't mean you'll be happy. Cancer doesn't discriminate, at least not in my practice. So we have plenty of people that are already brain injured or have a neurological disease, meaning your brain is more vulnerable. So chances are you may have more challenges with the Chemobrain. Medical comorbidities. So again, if you have high blood pressure, you're throwing little mini clots. You have diabetes, and that's poorly controlled since they gave you all that high-dose steroids, and now you're having all these crises. Again, that can lead to some cognitive changes. So these are the things that add up. Genetic vulnerability. There are people that have a long-standing history of dementia in their family. And we don't always know the connection of A to B, B to C, C to D, but there's a good chance you're at greater risk than someone who has no family history of dementia at all. And that doesn't mean that you'll get it. It just means your brain's may be more vulnerable, which kicks into the last bullet here. The ApoE4 allele has been associated with poor brain healing. One out of 4 people, 25% of people in this world have the ApoE4. It's just the way your genes cross. Anyone know their genetics? Half mom, half dad. Things cross. You get a quarter, a little bit. It's 1 out of 4. The reason we know about the ApoE4 allele has nothing to do with cancer. It has to do with Alzheimer's disease, and it has to do with the head injured coming back through the military. Access to huge numbers of people. Why do 2 25-year-old men with the same head injury, one gets better and one doesn't? Why? It's down to the genetics. And this is something we're looking at in one of the studies we're doing. Tim Allis, another huge researcher in this area, Mike Andrzejkowski, this may be the wave. If you are identified, maybe not now after the fact, but pre-chemo exposure as having the ApoE4, there may be some consideration of not hitting you with the heavy-duty pesticides. Just a thought, but at some point we're going to have to tailor it down to, we'd love to be able to tailor the cancer care down to the genetic level. So what can also lead to some cognitive changes? And the reason I list this is you've got to rule out everything before you can land on Chemobrain, okay? Because if these things are fixable, if you do have a metabolic disturbance, if you're running an infection, you're not going to test very well for me. If you're in chronic pain or poorly controlled pain, if your pain management person's giving it out with an eyedropper and, you kind of need a bucket, you're not going to test very well. Chronic fatigue, physical and mental, low counts, maybe a GVH that's settled in your liver metabolically, you're not going to do as well. You're filled with some toxins, you're not going to test very well. Someone put you on a med that just isn't working for you, but you feel fuzzy or sleepy. Cachexia, is that a word you all know? Really wasting away. Your fat is now being used up by your own body. If you don't have the energy to run your body, you don't have the energy to run your brain. Good old-fashioned sleep disturbance, and the early menopause. And I always want to get these questions answered in my assessments to know what can we treat before I kind of go off in the other realm, because I don't want to neglect a medical problem that really needs treating. Thyroid conditions are another one that's very common. And we have a pill for everything, a pill, a patch, a gum, an injection. And there are people that want to go ahead and, I really want to help you. Let me write you another script. Well, I'm a PhD. I don't write scripts, so I'm off the hook on that one. But if you look at just this little mini list, and goodness knows, you can see all kinds of problems. And if you look low or flat, your average GP, and I'm not slamming them, but they could really say, let's put you on some Zoloft, some Paxil, some Effexor, some Lexapro, one of the antidepressants, because, of course, you had cancer, so you're probably depressed, and even that can lower you and slow you down. And some of the other medications I've talked about. But there are people that really feel like more is better in the pill realm, and sometimes I just have to help with the help of the oncologist and the transplant team, get some of these meds out of people's systems to see what their brains really are doing. I use cartoons. And this is the short-term memory clinic, and she's saying, shoot, what did I come in here for? Now, how many times have we walked into a room and gone, what did I walk in here for? And if you don't raise your hand, I know you're fibbing, because I do it too. Okay, that is not Chemobrain. Okay, I do it, and I haven't had chemo, knock on, I don't know what this is. So what happens, though, is you can become overly focused. You can overinterpret everything. You can almost catastrophize. Oh, my God, I lost my keys again. It must be the Chemobrain. No, it's because when you walked in the door, the phone was ringing, and you ran to the phone, and you set your purse down, and then your kids came in, and they jumped their backpacks on top of your purse, and you answered the phone, and you forgot that you threw it on the floor, and they dumped their backpacks on it. That's not Chemobrain. Okay, that's just crazy life. So I think it's really important that you don't overinterpret life's little blips. Okay, because it happens to everybody. So when I'm working, as I do, what do people tell me? A lot of my patients want to show me their driver's license picture, because I see everybody pre-transplant at Moffie. This is who I am, and this is who I want to be. Now, why a DMV photo works for anybody, I don't know. But they're not steroid poofy. They have hair. And they actually look relatively happy to have just gotten their photo done after waiting in line for 2 hours. So this is what people want back. They want to go back to who they were. Now, if you're a few years out of transplant, I have to remind you, you'll never be 3 years younger. Okay? So, we can't pretend those last 3 years never happened. So if you want to go back to who you were, you have to incorporate who you've been for the last chunk of time. Fatigue and petering out quickly, difficulty with multitasking, coming up with the right word, they know it, they can feel it. But you'll probably notice I do that a couple times today. Being a little bit more forgetful than usual, or a lot more forgetful. And then the subsequent emotional distress, because nobody wants to feel like they're losing their mind. Okay? So you walk into the room and you're not sure you're there, so you can laugh it off or go, I'm going to retrace my steps. If I'm in the living room, it's probably because I left my coffee there. Perfect, got it. Okay, I'm done. I did it. As opposed to, oh my God, I gave it. If you catastrophize, you probably won't ever get to that coffee on the coffee table while it's still warm. So how can you figure out what's going on with you? Well, I always tell my patients, and once we get the baseline, and they go on to transplant, and emotionally and medically they're doing relatively well, I don't even want to see you for testing. I'll see you any other which way, but not for testing right away. It's too soon. The results would not be meaningful for looking at just a matter of weeks or a month or so out of transplant. Too much has happened to you. I don't want to stick some label of some Z-score, T-score, loss of function just because you've been acutely ill for the last few weeks or a couple of months. Got to rule out the medical. I like to see patients when they're seeing one of their oncology docs at the same time. I don't mean like at the same minute, but like within the same day or two, so I can look at their labs, see what's going on. Got to talk about general wellness. If you're not eating and you don't have the right nutrition, and I'm not talking the food pyramid because that's kind of hard for everyone to do, but I'm talking just enough calories to get through your day. You need that to think. Sleep, huge problem. And substance use, prescribed or not. Okay, we have a lot of issues with that, and there's a lot of stuff that we are now learning. Long-term use, not good for the brain. A lot of those benzodiazepines may have been helpful in the moment, but you're living on your Valiums, your Xanax, just to kind of cope with the crisis of your situation. At some point, you may be doing a little more harm than good. Same with marijuana. It may settle your stomach briefly or put you in a happy place for a little bit. It's killing brain cells. Maybe at a rate that we can't really fix for you. I think we've all seen sort of long-term marijuana users, right? And you can't call that Chemobrain. So once we rule out the stuff that's fixable, let's get tested. And hopefully it's someone who knows what they're doing. There's nothing I can't do in an hour. So if someone tries to say, oh, it's 10 hours, it'll be $3,000, they're taking you for a ride. You do not need IQ testing, achievement testing, no ink blots, no fill in the bubble and determine your personality subtype thing. Not what you need. You just need to know, am I working at the right rate I'm supposed to? Can I shift my attention fast enough? Can I basically get things done for someone in my age and of my educational background? The other thing I really want to point out, which kind of threw another monkey wrench into the literature, is that subjective complaints. When people say, I've had all these problems, and they fill out their checklist, it rarely matched cognitive complaints. So this was another problem. So I find testing very therapeutic. As soon as I'm done, I flip my paper around and say, this is what I'm seeing. You're kind of 2 standard deviations above everybody else in your age range, so you may be different, but I'm going to have a hard time. And I remembered all of them? Yeah, you did. But it was hard. I didn't say it wouldn't be hard, but your brain is still working. I'm going to zip up a little fast for time. So again, when I'm interviewing someone, the concerns are inevitably thinking, the emotional side effects, the role they're now in the family. If you're not thinking as well, you feel less than 100%. Other people start stepping up for you. Oh, no, I'll pay the bills. Oh, no, I'll drive. Then you feel even less than a whole person. Work and finances. I want to know basically who were you? Medically, psychiatrically, work. Are you eating, sleeping? What are you doing with all your substances? Caffeine and alcohol. I like caffeine, by the way. I shouldn't really put that next to alcohol and smoking, but it is something that's legal, and it is something that a lot of us do. And then if there really seem to be problems, I'm getting into safety issues like driving and the ability to make decisions. The testing, like I said, has to be unique to what the problems are. Attention, memory, executive function, the speed and stamina, a little visual, spatial, and a little bit with language. And I really want to know what's your mood like, what's your quality of life. Because if someone misses a couple questions, but they're having a great life and they're happy, I'm not going to say, well, you missed 2 on my word test, because that's traumatic. What do we care, right? If it doesn't bother you, it's not a problem. So what can we do to treat? Well, probably the best thing out there right now from the pharmacy world really is a stimulant. And you can test some of this yourself if you want to see how you do with or without coffee, and maybe try to get through the, Sudoku or crossword puzzle or a conversation. Because what happens is it basically gives your brain just a little bit more energy. Okay, so Ritalin was the bargain basement one that we used. It's cheap. $5 a month is, I think, the going rate for Ritalin these days. Has street value. So it for some people. It cannot be handed out as easily as it used to be. It is an abused substance, unfortunately. We at Moffie have switched to Provigil whenever possible. A little bit cleaner, a little less side effects to appetite. Ritalin is abused as it's an amphetamine, so it's used as a diet drug. A lot of people don't need a diet drug right after transplant, so we find that the Provigil is a little bit more helpful. There's some thought that if it really is a true functioning memory impairment, something really, not just, hey, you're a little slow or missed 1 or 2, but really a big memory problem, the Aricept and Namenda from the Alzheimer's world has been used. If there's a subsequent mood disorder or one that's overlying, I didn't want to make fun of antidepressants. I just don't think they're the end-all. If you're truly depressed, get it treated. But that shouldn't always be your first stepping point for treatment. And then some of the therapies have been very helpful, and there's one particularly that I want to get into. I'll get to in a minute. But part of it is really kind of helping people be reassured. I know what you're doing. I've seen this before. Think we can get you better. That's on the therapy side, and kind of help your family adjust. Compensatory-wise, I think people like to be told things they can do. It's one thing to be labeled. It's another thing to say, well, now what am I going to do about it? If your vision was changing, and I'm looking around the room, and I see a lot of people wearing glasses, right? Were you wearing glasses when you were 20? I bet some of you weren't. Were you wearing glasses when you were 30? Maybe. I think they say 40s are when you kick in. If you're going to be an adult glasses wearer. Did you fight it? Maybe. Did you have trouble seeing the TV or reading? Probably. So then you had to say, okay, I'm going to give in. Same thing with compensatory strategies. It's not a sign of failure. It's not a sign of, oh, God, I better write that down. Dang it. It's like, this is how I'm going to do to stay whole. How many people are hard of hearing and don't wear their hearing aids? How annoying are they? I got a husband. I have a $3,000 hearing aid sitting in the drawer. But anyway, the point of it is if you have there's something that's pretty simple, Post-it notes, I don't know, Staples, buy one, get one free, why not just do it? instead of fighting it. Same with tricks to the trade. Put your pills out for in the 1 week. Again, I did get a text, where's the waffle iron? Someone's using my brain for that, okay? Instead of them learning where the things are in our kitchen, they're using my brain. That's what you can do. Borrow someone else's. If it's really not that important, honey, you do it, okay? Don't take it on as something like a mountain you need to climb if someone else will climb it for you. And then really try to link things together. Like I said about, can't find your keys. If you can always put your keys down as you walk in the door on that back counter. I link walking in the door, I put my keys down. They'll still be there unless someone stole them, okay? If you have to remember to take your pill, I assume all of us brush our teeth in the morning and just say yes. Yes, I do. Put your pills next to your toothbrush. If you brush your teeth, you got to rinse your mouth. There's water there. There's your pills. Okay, I can't forget them because they're right there. That's only one memory you've just made instead of two. Okay? So link the easy things together. If you're easily fragmented with your attention and it kind of stay away from distractions if you can. Turn the TV off when you're trying to do your bills. Okay? Avoid crowds. Never come to sittings like this. Too many people. No, I'm just kidding. Please come to these things. Watch how tired you are. Do not sit down and try to do 10 important emails when you're wiped. You're setting yourself up for failure and frustration. Avoid interruptions. My phone's on vibrate. I'm not picking it up. I just want it to, or actually it's just going to go to message. Okay? A do not disturb sign is real. Tell your kids, don't talk to mom for the next couple hours. I need my time. And really focus on some general wellness. I like to use this analogy. When you go on vacation, do you sleep the whole time? No. I hope. Waste of money. So hopefully what you do is if your brain might need a vacation. So if you're sitting there struggling through a pile of paperwork or emails, do something different. Take your brain on vacation. Look out the window. Pet your dog. Have a drink. Don't just think, I'm going to make myself do it. Because you will burn out, you will make mistakes. Your brain likes little mini vacations. It likes to use senses other than what the seeing that you are doing. It likes to smell things. It likes to taste things. Post-it notes. I got them everywhere, okay? You never knew, did you? So what else can you do? Your brain is a muscle. Better use it. Absolutely. Try not to take up a whole new hobby, like I'm going to learn, Mandarin Chinese and be fluent, in a year. But what do you like to do? Do you like to read? I wasn't joking about the Sunday paper and doing the puzzles. Take a class about something you've always wanted to do. Again, it's a nice distraction from cancer recovery, transplant recovery, and it also lets your brain do something else. Try not to multitask. If you're cooking dinner and your kid's asking for help on the math homework and the phone is ringing, let it go to voicemail. Tell your kid to be quiet and cook your dinner. Because you'll either yell at your kid, you'll forget who called, and you'll burn dinner, and then you'll be really angry at yourself. So really watch the multitasking. I don't like doing lists or keeping a diary, but I put it up there because someone might like to do it. I can't stand it. That's busy work and takes from my energy. So if you don't do it, don't do it. If you love it, go ahead and do it. I'm not doing it. General wellness. Sleep, eat, don't smoke, don't drink, don't do drugs. You knew that already. Don't do it. Those things hurt your brain. And really try to avoid emergency situations, like don't volunteer to do the carpool in the middle of a Florida thunderstorm, or, think, what, if someone else can do it, that might be too much for me. Or kind of just be aware of the things that can put you in a vulnerable situation. So if we're going to do any kind of rehab or work, foster the hope, address the fears. Get some data. I like the testing to see people where you are now. If we're going to treat you, let's see where we can get you. Try to make it meaningful. If learning a 10-item word list really isn't all that important to you, well, what would be important to you? And try to make it meaningful to their everyday lives. Try to help set routines. Try to minimize some of that catastrophizing, that's that cognitive distortion. I walk into a room, and I forget what I'm doing. I must have Chemobrain. I'm now going to be Alzheimer's. I'm going to be in a nursing home. Life is over. Not really. You just forgot why you walked into a room. So those distortions, that all or nothing black and white thinking, and help people relax. Just take that extra minute. It's important to document so I can get my information right back to that treating physician who will go ahead and maybe write you a stimulant or look at some other possible medications. I think people should have everything about them. I don't want to know anything about you. Get my report. You might need it to get back into school. You might need it for legal reasons. And it's really good for us to kind of keep this in a database, anonymous and everything, so we don't know it's, your memory testing. But to really help the cancer world really understand what we're doing. So the research is really more neuroimaging, better genetic understanding, finding a better definition of this cognitive impairment, make sure all of us are doing very similar testing so we can talk to each other, not someone giving out ink blot tests one day and IQ tests the next and memory tests the next. Okay, we all should be doing similar things. Really learning about better medications because, it's kind of chemicals that got you into this trouble. Maybe chemicals can get you out of this trouble. And really better understanding. Some of the better research Karen Sevilla out at the Hutch is amazing. She just published a long-term study with 5 years post-transplant. That's a nice long-term study. Mine only went 1 year out and it was still hopeful, but 5 years is awesome. And she did see some subtle changes as late as 5 years out, with most improvement occurring in the first year. Okay, so that was kind of like, whoosh, now I didn't get that last few percent, but not for everybody. Again, just for some people. And the other thing I really liked was this Ferguson and Alice have been trying to employ memory and attention adaptation training. And what it isn't memory rewiring. It's basically teaching you to be kind of like a sports commentator. Anyone watch football last night? A lot of good wins last night, except for Georgia, sorry. Anyway, it was really good. The analogy is the same. Okay, I'm going to cook biscuits today. Okay, for biscuits. Okay, go to the pantry. Okay, I need my flour. I need my bacon soda. Okay, got it all. I'm talking my way through it. I'm doing it step by step. Oh, good. Okay, now I'm stirring. As opposed to like, I'm just going to do it and hope it all works out. You walk yourself through each step. You sound maybe a little foolish if you have a lot of people listening to you, but if you can do it, so this is what I'm going to do. I'm going to verbally mediate. I'm going to walk myself through these things. Then you can almost see how well you can organize and sequence outside of your head. You can hear it, you can see it, you can feel it. And that's helpful, particularly when you're locked in your head and you might miss some steps. So I think things are more hopeful than they were back when I started doing all this in the late 90s. I do think individual cancer care, hopefully at the genetic level, we'll be able to tailor-make some of the treatments. Hopefully there'll be some better neuroprotective agents or treatments. And I really hope that everyone gets what they need when they need it and not at the cost of like a small car to get it. Timing and expense for a lot of people are the hurdles to get over. So now we get to switch to questions. How did I do, Karen? And just as an example, she's flashing me cards, so I don't have to worry that I have to remember time. I gave that one away, right? Because I couldn't multitask. I used her.
Are there any tests going on for people? I have had my bone marrow transplant 23 years ago.
Oh, wow. So I'm going to give you a hand.
And I didn't even know of the word of Chemo-brain until a couple of years ago, and I just thought I was getting dumber and dumber. And no one in my family understands it to this day. They think when I can't grasp the computer that I just don't want to. Are there any tests that I could have? I do live in Florida. I had my transplant at Shands. They followed me for about 5 years, and that was about it. And I would love to know what my brain function is now, because it seems to be in the sewer.
Well, I can tell you, the University of Florida has where I trained, go Gators, has a huge clinical psychology, neuropsychology clinic there in service. And they would add in the neuroimaging and the blood work as well. I don't know, are you still living in the Gainesville area, or? Okay, so right. Again, cancer-free, yes. 100% brain function, maybe not. But again, you got what you needed from your oncologist.
Yeah,
so
I'm talking to you today.
Yes, and there's probably not, I can't tell you there's like a whole group of you out there.
I haven't slept until I still don't sleep.
Well, definitely. I think a full assessment, whether not just the testing, but to have someone actually look at your blood and get some scans. But they're not looking for the changes we've talked about. They're looking for things that prove to them that they did a great job and cured your cancer. That's what they do. Ask for a referral for cognitive testing, either at Shands or Moffitt, or even Florida Hospital. Just cognitive testing. Just bargain basement testing for cognitive function. Well, again, unfortunately, this is going to fall into the category of whatever damage was done with the transplant and that acute recovery. She got a little bit of time. Her brain is probably more vulnerable because she's already been exposed to the chemical challenges of the transplant. And now by adding, and I don't know what agents, your wife is getting, but again, anything that's designed to kill certain cells in your body and take away your energy, it's going to make it harder. Well, and as you know, they have peripheral neuropathy issues, right? So we know those are neurotoxic. Whether they cross the blood-brain barrier, we don't know for sure, but the potential's certainly there. And then having the steroid on board ruins your sleep, shortens your fuse, does crazy things to your appetite and your sugar, even if you were never diabetic to begin with. So metabolically, she's definitely at greater risk. So again, the quality of what she does could still be very good. Just don't ask. She can't do as much as she did. Her full-time job is to get through her maintenance. You would have to basically ask as they're doing your typing to see, do you have the allele or not? Whether people will pay for it, I don't know. We use it more as a research marker, and I can tell you the government, through the VA programs, use it as an after effect to say, why is this soldier not getting better than not? And same if there was a diagnosis of Alzheimer's and you were in a research protocol, they would do that. So it is still in the research phase. You kind of want to hitch your wagon to a research protocol that's looking for things like the ApoE4 and cytokines and some of these other markers that give everything a little bit more credibility and credence.
Would you know which research arms those are?
I can only tell you at Moffett we're looking at the cytokines. I know Tim Ollis, AHLES, is absolutely on the ApoE4, and he is in New York at the Sloan Kettering.
You mentioned stimulants, so I want to give a miracle testimony about a stimulant.
Oh,
right?
Good.
I'm 6 years out from an autologous transplant for multiple myeloma
Awesome.
in complete remission.
Yay.
And suffered for 5 years with huge chronic fatigue, sometimes needing 2 naps a day, falling asleep at red lights while I'm driving.
Not good.
Okay. I kept bringing it up with my primary care physician for a number of years. Finally, after doing research, I begged her, let's try a stimulant. I'm 63 years old. I'm game for anything.
Sure.
Okay, because I need a better quality of life. A year ago, I started Adderall. In 1 week, my life was radically changed. I no longer take an antidepressant, and I don't take any naps. And so I've had a miracle response.
I'm so happy for you. And you bring up a good point. Patients often have to know the lingo to use to get the referrals and the language to use. And if you say Chemo-brain and your oncologist doesn't buy into it, good luck to you on that. You can either say, when I was a child, I might have had some form of attention deficit disorder, but I bet you did, because it's the only thing that works. Because they will only write scripts for things that are FDA approved. Okay? So Chemo-brain is not even an entity, so you can't get a drug for something that doesn't exist, right? They won't write them. So you have to say, but I'm a little bit older and I don't have those results, but I feel like I did back in the 3rd grade when I couldn't follow the spelling words on the board. Then they'll go ahead and either ask you to be tested if someone like me is sitting in the next room, or they'll just say, we will diagnose you by treatment effect. And if you benefit, then you must have had attention deficit disorder. So you keep getting the script. Everyone's happy. They give you hopefully a good rate on your copay, and you feel better. So Chemo-brain in and of itself, you can hold it in your head and you can remember it, and so can everyone in your world, but maybe not your oncologist. Okay? So attention problems. Do I have early Alzheimer's? Don't think you do, but whatever you could use to get your foot in the door. The question is based on, are there any computer-based cognitive retraining programs with studies that show benefit? The few studies that are out there have very small sample size, and what they do suggest is that there is some patient satisfaction because they can master the tasks on the computers, but it doesn't always generalize to the real world. And so the thought being it can be helpful for some people, but not necessarily the answer to all the problems. But again, if it's something that works for you, I go back to using your brain as a muscle. If you feel you could get something by, taking a dance lessons or helping your child learn Spanish because you took 2 years of high school Spanish and it's bringing up, or using that sportscaster model of organizing yourself and keeping yourself on task. As long as you're using something that keeps the brain going, if that works, it's great. But I haven't seen, other than people being happy with doing it, huge changes in test scores. It does, but again, you're talking about one area of speed, and for some people it's more of a sequencing issue or being more forgetful or not coming up with the right word. In your case, did anyone try a stimulant, which would pick up your brain speed? No. That, typically, if we see someone with slowed, it's called psychomotor slowing. Psycho just means brain, doesn't mean psychotic or anything, just psychomotor slowing. There's a computerized test that I use. A lot of people have used it forever. It's the Hallmark test for attention deficit disorder, similar to what you're saying on speed and reaction time and how many errors would you make in a certain time task. I use that as a measure of how people are doing. You put them on a stimulant, and that normalizes very quickly. So it's unfortunate that someone didn't try that or offer that to you because that may have treated that one area. But on the retraining, if someone said, let's say you were against taking more medication. Some people are, like, I'm not touching it. I'll have a Starbucks, but I'm not having a pill. All right, same thing. And I see there's Starbucks all over the place here. So, but the point is that may be good for that one area of cognitive problems. But again, you can't say everyone has a processing speed issue. Let's do the study because only some people were satisfied, and the numbers were too small. Yes, unfortunately, a lot of people want the quick fix because they don't always live near someone who and can pay the bills for the longer intervention. But there have been some small sample studies and some case reports where that was beneficial. But again, you got to have the time and the money and the resources. And of course, time has passed too, and you look really young, so you have that on your side. I think it's a good idea too. I'm not saying don't do it. And again, I go back to the sort of potential for catastrophizing and fear that this is a permanent situation and that, Alzheimer's is a week away and these horrible feelings of despair. If anything that gives you that sense of accomplishment and empowerment, we all live in our head. We like the rest of us, but this is really who we are. And anything that helps that, let's do it. And anything that hurts it, smoking, drinking, drugs, don't do it. Well, that's two things I want to address. The question was really good. Could, this Chemobrain or cancer brain or chemo fog, whatever the label is, could it just affect one small area of function? Typically not. Typically it is new learning, speed. I don't think people can have a single stroke or have a little lesion or a little trauma that can take out something really unique in the brain and giving you some odd, limited deficit. However, in your situation, it sounds like you have a lot more exposure to numbers than the average person, right? So if you're a numbers person and that's what you do, if you're going to make an error, it's going to be with numbers. Doesn't mean you're bad with numbers. It just means you have more chances to make errors with numbers than someone who doesn't do numbers. Meeting new people, I don't know if you were great with names or not, but again, new people and new names are new learning, right? And that's what's hard. And chances are you didn't stop your whole day to meet Susie Q. Hi, Susie Q. Okay, Susie Q. Okay, and come up with a wonderful way to remember that. You're probably going, okay, yeah, really, I got some numbers to do. Okay, hey, good. I'm not minimizing it, but if you didn't give it its due, and any new learning, directions to get to that new restaurant or something, and you were still multitasking, or you didn't get the Post-it notes out and write Susie Q's name down and say she's the one with the blue glasses, But I go back to multitasking, and in this world, we're always trying to get 2 or 3 things done at the exact same time. You know your weakness. If you really need to remember Susie, because like she might be your new boss or something, and like decide if she's going to give you a raise or fire you or not, right? Susie's name down on one of those Post-it notes, and like a little picture, like I got to remember Susie, and link it with something like, okay, you know, because it's like you're wearing glasses, right? Dollar signs. That's right. I mean, you're wearing glasses, so you know you have to accommodate to stay where you need to be. Same idea. Oh, my memory now.
That's all right. You see a lot of
Do you
patients.
look better?
Yeah.
You look good
Well,
to me.
I was doing pretty good then because
Yay.
if I understand right, Moffat requires a pre-transplant evaluation by
That's
you.
me.
And
Yeah.
I was so impressed. You did a great job. You reassured me. Because
Can you imagine if I'd done like a bad... Okay.
Later, after
I
my
turned red.
transplant, within that 1 month that you stay there up from out of town, I developed some sort of, I don't know, but I guess I really have not looked at my records. I was so, hallucinations, terrible psychiatric change that I had never had, and I guess they think eventually said it was some form of infection, but, they were really, questioning me like, is this pre-existing, but it was very intense.
I'm sure my report said it wasn't.
Yeah, and my family reminds me of the crazy things that I was saying even when I was back home, but I still have some memory loss. I think I always seem to have a weak memory. Name recall was always bad for me, and it's even gotten worse. But my doctors they're wonderful, and they're so pleased. It's been a very slow progress. I lost the use of neuropathy, was really severe. The dosage of prednisone was so extremely high from my local oncologist, and then Moffat was very, deferred on reducing it, and there was ensuing, problems where my local physician refused to treat me anymore, but Moffat reduced it. So I may have been getting extreme amounts. So I was wheelchair bound for like a year and a half. I'm just walking again and doing the check. I mean, I lost ability, which I always did the taxes, the checkbook. I was a preschool teacher, but I had a lot of time at home. And it's just now I'm beginning to redevelop those skills and read a book and remember, at least half of what I read. But doctors never mentioned about going back and retesting. Would you recommend that?
Well, I would. But that sounds like I'm, asking for kickbacks. I don't mean that. Well, I do, because you brought up an excellent point. You did not have an uncomplicated transplant and recovery, okay? And instead of having, an infection that was maybe GI or a skin thing, yours was central nervous system, right? If you ended up with this level of confusion and an altered mental status, AMS, delirium, same, they're synonyms, that is a whole other problem in and of itself. As long as you were, for the time period that you were altered, is the word they use, you almost have to give yourself like a month for every week you were altered, even just to get back. It's not like, I was altered for a week, I need a week to recover, and I'm me again. Your brain was basically chemical soup with levels all out of whack for a very long time, and it takes a very long time for that to normalize. It sounds like your normalization has been steady, but you also having the high-dose steroids leaving you with muscle wasting and weakening, and sure, sleep was off the chart. Everything was off. Makes it much more complicated. But neurological problems that I've seen in transplant, not only in altered mental status, there's certain infections that have that like to settle in the brain, and that's been so heartbreaking. But with good, if you got a year to recover, if you can give yourself a year without being, despairing, you can get some light. But if the complications hit at the brain level, kind of almost everything I said, you got to delay it another year. Don't be just linking something next to your toothbrush and think you'll be fine. Unfortunately, because yours is much more serious. Is it from cognitive, or because they're worried about being exposed to little people? I call them petri dishes with legs. I mean, they're just running around out there. So be careful. Okay, but definitely, I think particularly there would be a nice baseline. You can do a pre-post to see where the areas are. But I do find testing in a strange way therapeutic, because a lot of people have, You don't have to see them. You just ask for them. Or the primary nurse. Or the PA. Or Millie, Ken, or Diane, the schedulers.
I'm 20 years out, and I was basically dropped. I've had no follow-up in 20 years. My question is about stamina. When you said you start lots of things, but you're unable to. I've started a kabillion things, and I'm not able. I've never been able to work for an extended period of time. Not having any follow-up, everyone just thinks I'm screwed in the head. But it's been I don't know, and I'm in Canada, so I'm not sure where I would even begin to go for testing or even thought of it, because I've just tried to live a normal life like nothing ever happened. So.
You said you're 20 years old? Or
20 years out of a transplant.
Because you look really young, so when you said you're 20 years old...
I was 17 when I had it, so I'm 37 now.
Wow. Don't look it. So you would definitely... Your brain was pretty vulnerable at 17, I'll just have to say. It was in the growth period.
Yeah.
You were really going from being a kid to an adult when they put the pesticides in. So you, of all people, at that age range, kind of could get stunted a little in the teenage years.
Maybe that's why I still look 17.
You do, yeah. Well, that's why I was thinking that 20 worked for you. Again, one sign of attention deficit disorder is starting lots of things and never quite finishing. So the idea of a stimulant, even a trial of something pretty clean, like an Adderall or a Nuvigil or a Provigil, I'd be curious to see if you felt more in control of starting and stopping things. Because right now, you may have the brain energy, but it may just be going off in different paths. And so also getting someone to guide you.
Where would I go for
do you
that?
Do you have even a primary care at this point?
I've been bounced around so much because no one knows what to do with. Like that, I ended up in a smaller town, and I went through everything that town could offer, and they're just throwing up their hands.
Because you were 17, you were a child. I mean, most 17-year-olds don't want to think they're children, but...
Well, I was 15 when I got sick. So.
Okay, so you're a kid. And so you would really probably be best off in what's called a survivorship clinic. And most of the major cancer centers have a survivorship clinic. This is where the regular community goes, I'm not touching you because you had cancer at some point. Typically, at least 3 to 5 years out of active care, which clearly you fit that criteria. And there really is a push to address the issues from childhood cancers and the treatment of childhood cancers. Some of the issues that, whether it's the cognitive side, sometimes there's changes to bone strength and health, skin strength and health, fertility issues, energy issues, that the rest of the world is like, I don't know. So are you near a major center?
I've just moved back to a major center because the place where I was, they didn't know what to do with me. They ended up putting me off to the mental side of things because I spent time going through the psych ward and this and that and diagnosed me with so many different things, and I've been on probably every antidepressant there is.
Yeah, but were any of them stimulants?
No, I've never been on a stimulant, and I've had chronic fatigue the whole time and insomnia and all that, but I've never been put on a stimulant.
I would look for a survivorship clinic. You can even call the American Cancer Society and say, what's my best bet to get in?
I live in Canada.
Okay, the Canadian Cancer Society. Is there one? Canada.
There is one, yeah.
I don't know anything about Canada. I know where it is, but it's really big. I'm just thinking of resources.
Well,
and you have health care.
I have health care.
With a long waiting list? Potentially?
Well,
is it hard to get?
There is a lot.
Yeah, but you're not asking for anything medical. You're not asking for an MRI. You're not asking for...
Just like the cognitive testing, would I be asking for that?
Either testing or I'd like to try it. I had cancer as a teen. I had a transplant. I've had a lot of chemo. I think I fit the criteria for adult-acquired attention deficit disorder. Adult-acquired attention deficit disorder. I'd like to try a stimulant. So you can put me through a bunch of testing and cost your socialized medicine system a bunch of money. You can just give me the pill.
Okay, what was that again? Sorry, I forgot.
Adult-acquired attention deficit disorder.
If you all have any other questions, if you could write them down, and we'll try and get them answered. Thank you.
Thank you.